طيب I'm gonna assume إنه الخبر يسمعنا. بسم الله والحمد لله والصلاة والسلام على رسول الله. Welcome everyone to the debriefing competition, the second competition of the day. This is the first time we do a debriefing competition in the conference, so this is inshallah a great start, and we'll welcome your feedback. We'll start with Dr. Muhammad introducing our learners for the competition today. Dr. Muhammad.
Consultant pediatric emergency. Today, inshallah, we'll start to present our participant in this competition today. The first participant, Dr. Najmi, is a faculty member from College of Medicine, Qasim University, and also Ms. Sajida Al-Qada. She is a clinical simulation specialist from Prince Sultan Military College of Health in Dhahran. And also Mr. Ajlan Al-Shahri, he is a simulation specialist from King Fahd Medical City. And last participant is Dr. Qasim Al-Qasim. He is from Anesthesia and Critical Care Department, King Abdulaziz University Hospital from Jeddah.
The judges for this... Sorry.
Go ahead.
The judges for this competition will be Dr. Abdulalim Atasi, Dr. Usama Ziraiqi, and Dr. Abir Arab.
Thank you. Dr. Muhammad will help us introduce this scenario.
So this is for our participant, Sada, and so you are going to debrief the trainees who underwent educational session in how to break bad news in clinical-based setting using the spikes. The trainee in the scenario are two medical students, and the script scenario is going to display on the screen now.
Patients, can you give me the over, please? Hi. How can I help?
Are you the doctor?
Yes. My name is Amani. I'm the one who's running today the clinic, and this is my colleague.
I am also a physician.
Hi. How can I help?
I did the blood tests and I came to follow up the results.
Okay. What is your name?
Hissa?
Hassa.
13
Okay.
20 00 240.
Do you know what test you did?
No, I don't know. I'm not a doctor.
Do you know why you did the test?
No, I have no idea. He just told me I need to get the test, so I did it. Is there something wrong with me?
Just trying to find the test.
Did you need help and the calculator?
Do you think this is the test?
Yes.
Okay. Okay, I got it. So I think they did the test because you have like difficulty sleeping, and the results came back. You have difficulty sleeping before, right?
No.
No? Okay. So they did the test, and it's found out, like in the test, you have diabetes. So that's why, like, they brought you back here.
But what is diabetes? What do you
Diabetes,
mean?
it's a disease, and you have to take a medicine for it.
But why do I have to take medicine? Why do I have it?
It is a disease affect to your pancreas, and need not able to protect an insulin in your body. It's not enough because that you need to take medication.
Yeah, you did not notice that you're like sick or anything? Because diabetes, usually people become very sick.
No, I feel like I'm still young and healthy. Why do I need to take medicine?
The tests say that you have diabetes, so you have to take medicine.
No, I don't care about what the test says. I know this disease. Some members of my family, they got it and they had terrible complications. I don't want to have my legs amputated. And I have no symptoms like the other members in my family. Like, what do you mean I need to take medication?
Yeah, the test we did for you, it's really accurate. It is the hemoglobin A1C. And I think you have to take the medication and the medicine and go to your home and try it. And I'm sorry for your what's the happening with your cousin or nephew or your uncle, I guess, yeah?
Yes.
Yes, I'm totally understanding this. But you know, you have to take the medication, and we are here to help you.
No, but I'm not gonna take medication just because you think I should take medication. I need to have a second opinion.
Well, you can take a second opinion. As my colleague said, like diabetes is a disease which like your pancreas is not working very well. And we were sorry that we thought that like you know about the disease.
How would you assume that I know about the
How we
disease?
can-
I'm
how
just a
we can,
patient. I'm not a doctor.
How we can
Yeah.
we help you?
I don't know.
I think like if you want, we can give you like a brochure about the disease and you can read about it and like you can take a second opinion. We can schedule you next time with like the senior physician that we have in the clinic, and then you can see with them like if you want to take the medication or they have another option for the disease. And if you want to bring somebody else with you, like to see or to speak with you, or like any other person of your family, you want them to come to the clinic with you, I think can help you with this. What do you think about this plan?
Okay. Okay, I will do that. Thank you.
Yes, Hassan, we are here to help you.
We're here to help you. And I will give you like a couple of the brochures that we have, or like a website if you like to use the internet, and it can give you an idea about the disease and how to treat. Not all patients actually got amputated. If we get the disease early on, then probably you will be fine and you will not get the disease.
Okay, thank you.
Thank you so much. We'll schedule next week, right?
Okay.
Now we would like to introduce our medical student, Dr. Amani and Ustad Al-Jawhara.
Okay, so Dr. Amani will be the one who get debriefed. Unfortunately, the participants from Jeddah could not participate today, so we'll start with the participants from Al-Khubar. May I ask the participants from Riyadh that they leave the room so they can so the Khubar can start?
Yes, they already left.
Ms. Sajida, can you start?
Okay, well, you can start. We will focus on the reaction phase of the debriefing for the sake of time. And as we explained earlier, we use the dash format for assessment and the results later. You can start.
We'll spend a couple minutes talking about your performance during the simulation scenario. My role in this discussion to facilitate the conversation between the team, and I expect from you to share in that discussion, to answer a question, to open to share your perception in a professional manner. Just think about the reality of the scenario. Simulation not exactly like a real life scenario, but we are doing our best to be realistic during the scenario, and we are learning from our mistakes. It will deal with it like a puzzle to solve, not crime to punish or to feel bad. I will guide this discussion in 3 phases. First phase will talk about how it was the scenario, how it went the scenario, how about your feeling during the scenario. Then we will dig deep, so deep. Then we'll talk about analysis and understand what happened and how we can improve our performance. Then we are going to summarize, take-home message, and we will summarize the key points. So the goal of this scenario, as we mentioned at the beginning, it is about communication. How we can break bad news for the patient using Spike's technique. Amani, can you tell me talk about your feeling during this scenario, if you please?
Yes, I think my feeling is I was very happy. I think I did very well.
Can you tell me about your feeling? How it was the scenario for you talk about the scenario, feeling during the scenario.
Very happy doing the scenario, and I felt very comfortable when I was doing it.
Thank you, Amani. I want to hear from Johara.
Yes, I'm also very happy because I'm doing very well.
Okay, great. Let us recap about what happened during the simulation scenario. Anyone from the team can summarize what was going on during this scenario?
We had a female coming to the clinic with following up her results, and it turned out to be having diabetes, and she did not know. And we told her that it's a treatable disease, and she can go and take the medication and be happy, and afterwards, if she starts the treatment, she will be well.
So, now, let us talk about the technique that you use. Thank you, Amani. We will discuss Spike technique. Can you tell me, Johara, Spike stands for what? Let us start from S.
Sitting.
I'm curious to know about how you prepare for the sitting.
The place, and there is a tissue, and we are introduced for us first. Yeah, that's it.
Okay, great. I saw you during when the patient came in the scenario. Get busy with your phone. I wonder why.
Why? I didn't remember right now, but I guess it's something urgent.
Why?
Why? When she entered first, maybe in the next time when she inserts the room, I leave my phone. I leave my cell phone.
Okay, طيب, Mani, when the patient came in, you were busy looking to the computer screen. Help me understand why.
Looking at the patient name just to make sure she is the right person, that she is in my clinic.
You knew you had any idea or any information about the patient before she came in?
No.
So in that situation, how you are going to look for information about the patient who will come inside your clinic.
Well, maybe next time I will try to look for the names before they come, so it's going to be easier for them to do that and introduce themselves in a better way.
Let us talk about the body language now. I saw both of you sitting behind the table, busy, like I mentioned before, Johara with her mobile, getting Amani focusing on the screen. I think if you want to speak with a patient coming to you, you need to give him attention, him or her. I wonder why didn't do that?
Yes, maybe next time I sit beside with her and rub it in her shoulder.
Okay, thank you very much, Doctora.
My time is over.
Thank you.
Zahra. Thank you, Amani. Thank you.
Welcome.
Okay, can you hear us? And
So our next
Jeddah,
participant,
Yes, we can hear Jeddah, and we can hear Khubar.
okay, Dr. Muhammad, thank you very much. Now we'll move to Riyadh. So can we have one of the participants come to debrief Dr. Amani, Dr. Al-Jawhara?
Because Al Khubar have a problem with the venue, they're going to close the venue soon, so Dr. Muhammad will have his candidate first.
Okay.
Okay. Doctor.
Assalam.
We will have our debriefing session today, inshallah, with the instructor. And what we're going to do is, first we're going to give you a chance if you have any concerns or comments, and then I'm going to give you feedback about your performance and give you some time to reflect on your performance, and then finally we're going to summarize what were the points and what were the points that you need to improve for your next inshallah sessions. So, first, okay. First, do you have any comments or concerns that you want to discuss?
I think we want to know, like, if we did a good job, because we read the material and, like, we practiced it before. So we want to know I want to know if I did good. What do you think? Johara?
Like Dr. Amani, I want to know.
You followed the spikes, and I think I like very much that you set a very private environment and there was no interruption. That was really good. Then when you ask the patient how much she knew, it wasn't, first she didn't, you just tell her that she had diabetes. And it's good to ask her how much she knew about diabetes. And then you need to explain to her, when you told her this is a problem of insulin, the patient might not know exactly what is the effect of that. And you tell her that she needs medication. So it'll be good to explain to her what does it mean to have a problem in insulin in terms of what is the effect on her body and why is the medication necessary to take. And then you need to tell her about the prognosis also and what is the treatment plan and what will be coming next. I like that you've addressed her concerns about her ankle, and you emphasized you were good when you confident and told her that she's not everybody will have amputation, But that's also a good point to further clarify to her that what's important to know about avoiding these complications so that she didn't get them. And you need also to encourage her to ask questions. And I see that she's not convinced, and that is that's expected because it's not. When a patient had a bad news, they may have this denial, and she seems to have this denial because she's saying she feels well, and that's okay. But then you need to give her some time to sort of to have a silence for a while so that she reflects on this and she could sort of think it over. And her reaction was expected, the denial is said so. So I think what you do is to sort of, after you give her some time to reflect on this, to give her some more information that help her to make an informed decision about the treatment. And it's good that you gave her these brochures and websites to go to. That's a good point. And it's good also to tell her that where she could get support. And of course she was sort of in denial, and she requested a second opinion. And it's good that you gave her a chance for a second opinion. But what you could do is you could try and sort of discuss with her in simple terms what does that mean. But now she's requesting a second opinion. I think that's a good idea to give her some information to go and look it up. Yeah, okay, sorry. Okay.
Shall we move to Riyadh?
Okay, we'll move to Riyadh. Can we have can we have a competition in Riyadh? Can you hear me in Riyadh? رياض دكتور أماني تسمعينا؟
سامعينكم. السلام عليكم. سامعينكم دكتور براء. بس دقيقة يجينا الكونتستنت.
طيب.
Yeah.
ننتظر الرياض. I want to take this time actually to thank Dr. Al-Jawhara or Dr. Amani for their participation. It's not easy to come out and get debriefed in front of maybe the whole world as we are online.
أخذ أوسكار
So
أنا
thank you
والجوهرة.
very much for your time, for doing the scenario, and we hold the basic assumption here again that we discussed during Simdauri.
يلا جاي.
Yes, I would like to introduce myself, Ajlan Al-Shehri, and I would like to debrief Dr. Amani and Dr. Al-Jawhara. So let's start. Right. Describe what's happened in the simulation, Dr. Amani and Al-Jawhara.
So we had a patient who is sick and she having symptoms of she's she's not feeling well, and she came to the clinic, and me and Johara told her that she has diabetes.
All right, and now we would like to know your feeling. How was your feeling after the simulation?
I'm happy. I did very well, actually.
What about you, Dr. Amani?
I think we're medical students. We don't know much, so I think we did very well.
But you feel that you're happy and you.
I feel comfortable and happy.
All right. So we would like to talk about the non-verbal communication. Could you tell me what went well during the simulation?
We were medical students and in the clinic, and we were breaking bad news regarding diabetes.
So I would like to remind you about the objective of this simulation. It's about how to debrief a patient and give him deliver bad news following the spikes. So I would like to hear from you also, Al-Jawhara. Tell me what went well with you during the simulation, please. So I noticed.
Yes, we did very well.
Yes.
In this session.
So I noticed it's about the non-verbal communication, and I noticed that Dr. Amani was looking to the screen and talking to your colleague. So at that moment, what was in your mind?
Well, I don't know her name, so I was looking at the screen to make sure that she is the right patient who's coming to see, in the clinic to visit us. So that was what I doing. And in my mind, I want to double check that she is the right patient.
All right. And what do you think also? I noticed that Mr. Al-Jawhara was looking at her phone. I wonder what are you thinking at that moment?
Sorry, but I get a message from my mom. I have to answer.
All right. So I would like to explore about the communication and how it's important. Would you please tell me about the importance of the communication, especially with when delivering bad news to patient?
Maybe I wouldn't use my phone in the clinic next time, or when she entered the first.
And I guess like I will make sure of the patient name before I let them come to my clinic.
All right. So the summary.
Thank you so much, Adnan. Time is up. Now we're going to move to the next session. Thank you so much, guys.